Assalamu alaikum everyone. Today my presentation topic is clinical syndromes associated with disturbance of water, electrolytic and acid-base balance. Homeostasis requires balance of water, electrolytes and acid-base levels. It is vital for cellular function, neuromuscular activity and metabolism. Imbalances can lead to serious consequences and common in critically ill patients. Water balance disorders. Uh, there are some water balance disorders, syndromes of inappropriate antidiuretic hormone secretion. It occurs by excess antidiuretic hormone, then it occurs water retention, and finally hypoatemia. It causes by CNS disorders, medication, small cell lung cancer, and there are some symptoms: headache, nausea, seizures, and coma. Treatments are fluid restriction, vasopressin antagonist, diabetics insipidus, antidiuretic hormone secretion deficiency or renal insensitivity, then it occurs water losses, and finally hyperactemia. There are some symptoms: polydipsia, polyuria, and treatment are available central and nephrogenic. Dehydration. It occurs by antidiuretic hormone deficiency or renal insensitivity and water losses, and finally hyperactemia. Types central when the antidiuretic hormone are decreases and nephrogenic. There are some symptoms: polydipsia and polyuria. Our treatment are central and nephrogenic. In overhydration, it causes by renal, cardiac, hepatic failure, and for fluid overloaded. There are some symptoms: edema, weight gain, etc. And treatment are available: fluid restriction and diuretics. In electrolyte imbalances, electrolytes are sodium, potassium, calcium, and magnesium. It disrupts nerve, muscle, and cardiac function. Sodium imbalances occurs by hypoactemia and hyperactemia. In hypoactemia are overhydration, symptoms are confusing or seizures. And hyperactemia are hydration occurs by hydration or diabetics insipidus, and symptoms are coma. In potassium imbalances, it occurs by hypokalemia or hyperkalemia. Its symptoms for hypokalemia are weakness, heartbeats so fast and slow, and hyperkalemia, its symptoms peak T waves. It's used for myocardial infarction such as heart attack, paralysis. In calcium imbalances, it also two types occurs: hypokalemia and hyperkalemia. In hypokalemia, symptoms are tetany and seizures. For hyperkalemia, its symptoms for stones, bone, depression, anxiety, etc. For magnesium imbalances, it also occurs hypomagnesemia and hypermagnesemia. In hypomagnesemia, its symptoms muscle cramps, um, and hypermagnesemia, its symptoms hypotension, cardiac arrest, etc. Acid-base balances. Normal range of pH 7.35 to 7.45 and maintained by buffers, lungs, and kidneys. There are some disorders. Disorders are occurred in metabolic and respiratory. In metabolic, it can be occurred acidosis or alkalosis. In respiratory, it also occurs acidosis and alkalosis. Conclusion: imbalances affect health at all levels. Early diagnosis and treatment are critical, and understanding pathophysiology improves patient outcomes. Thank you.
ঠিক আছে, তুমি যে সোডিয়াম ইমব্যালেন্সে যাও তো তোমার তো উচ্চারণের সমস্যা হয়েছে। সোডিয়াম হাইপো কি বলছো?
Hyponatremia.
হাইপোন না, হাইপো ন্যাট্রেমিয়া।
Atemia.
ন্যাট্রেমিয়া মানে কি?
Natemia. Sorry.
ন্যাট্রেমিয়া
Natemia.
মানে কি? সোডিয়ামের বৈজ্ঞানিক নাম কি? বৈজ্ঞানিক বানান কি? এই কেমিক্যাল বানান?
Sodium.
পাশে তো লেখা আছে। সোডিয়াম হাইড্রোক্সাইড লিখতে গেলে তুমি কি লেখো?
Um,
কি লেখো এই কেমিক্যাল স্ট্রাকচার?
Mm, sir, question